Now we're going to move on to Office of Systems Integration, OSI. Issue number 1, Meds Modernization Multi-Departmental Planning Team. We have 2 issues that we'll be hearing from this department, Meds Modernization and the EWIC, I'm sure you probably say it some other kind of way, Management Information System Project. Let's start with Meds Modernization. Good morning.
Good morning, Madam Chair and Senator Stone. Amy Tong, Chief Deputy of Office of Systems Integration, also the Agency Chief Information Officer for Health and Human Services. I'm here with Deputy Director Curtis Knapp, who's going to be speaking to the electronic WIC project coming up in a little bit later. And also to my right, Cynthia Talker, who is going to be speaking to the Meds Modernization Planning effort. Also in the audience, we have our sponsoring department, Department of Healthcare Services and Department of Social Services here for the Meds Modernization, as well as Department of Public Health here for the EWIC project moving forward. Both Deputy Director will be providing you a brief overview of each of the effort, and with that, I will start with Cynthia.
Good morning. Okay, so for Meds Modernization, I read the...
Can you move a little closer?
Oh, I'm sorry.
Mike, just a little.
Okay, oh, move it forward, okay, thanks. Oh, there we go, I can hear myself. For Meds Modernization first, this is a planning effort. The write-up that was done, that was part of the agenda, I think very much summarized the previous discussions that have occurred. So at a high level, the planning effort, Meds Modernization, is to take meds, which originally was utilized with the Department of Healthcare Services to store data for enrollment eligibility for a variety of health programs. Mm-hmm. What's happened is that it's broadened out to where now we have the Department of Social Services, we have covered California, and we have the 3 SAWS consortia, so the counties, that all interact with that data, and it's become a critical central point of data for all of our systems, and it's even used in other state departments. So what we're trying to do is the planning effort so far has been really focusing on what does Meds do now from a code perspective, right, that code analysis. And now it's become a multi-departmental, multi-partner discussion in order to determine where we're taking meds. You know, it's not just to recode it how it is. It's, you know, across the agency, how can we share those services better? How can we better interact with our county partners, you know, with the variety of programs that use it like IHSS, CalWorks. I mean, it's amazing the number of programs that interact with the data. So with this planning effort, we are starting visioning sessions, which include all of our critical partners, to really get that concept of where we're going to take this, what's the scope going to be of this effort, and what is our vision in implementing in a shared services strategy, both agency-wide as well as with counties. I mean, that's a high level what we're doing. Visioning being the most important, as well as meeting the, at the end of 16-17, at the end of 16-17, completing the second stage gate from the project approval life cycle.
Senator Stone, questions, comments?
What is the, I assume as you're looking at all this eligibility data, are you witnessing any fraud as a part of the process, and how do you?
So in this case, the current system is held by the Department of Healthcare Services. Mm-hmm. I don't know about their statistics of their current system, but I'm sure they can absolutely explain any of those questions with regards to the current system. What I'm overseeing right now is really where we're going to take or how we're going to meet the program needs, right? Both, you know, the business needs, the programmatic, constituent needs in the future. So where are we going to take that system? How are we going to transform it for something longer term and future? So I don't have those statistics.
So a major responsibility, of course, would be communicating with counties as people come into counties for welfare, for Medi-Cal. And what is the average turnaround time, if you will, with the IT capabilities of the state, counties communicating a new beneficiary, if you will? Are we talking a few hours? Are we talking a few days?
It depends on the implementation. There's multiple, I know of multiple systems that have implemented in different ways. And I think really each program and each system would have to speak to their statistics because it's not one system.
I know a year or two ago there was some real challenges with intercommunicating between counties and the state, assessing Medi-Cal eligibility. I don't know if those issues have been resolved and things are easier for the counties now to establish eligibility.
That's the CalHERE.
That's the CalHERE system
Okay.
that was under discussion at that time.
Okay.
While CalHERE interacts with MEDS, it's a different relationship with the counties than what you're discussing.
Or is it a different function?
Yes.
Gotcha. Okay, thank you.
Quick question, so it's 18 positions, and I'm clear, based on the write-up on the agenda, that it's for the planning phase.
Yes.
I guess what I'm not clear about is if it's your expectation that this would be for 1 year, if those potential 18 positions could then roll into other functions.
So currently, the request is for the limited term. However, or not limited term, limited funding, right, the right term, but permanent position. And it's really a strategy in, with regards to being able to do better retention and recruitment, especially in the IT field. And then when either an effort is completed, or sometimes when in a project we change phases, we go from design and development and we go into M&O, different skill sets are needed.
Right.
So this allows us to, to recruit and retain people and then move them to where they can best serve
All along the process.
portfolio in OSI.
Got it. Okay. LAO, Finance, LAO?
Good morning, Madam Chair and Senator. I'm Lourdes Morales with the Legislative Analyst Office. I would just note that we don't have concerns on this proposal, but I would add that lessons from other IT projects tell us that deficiencies in planning up front lead to challenges down the road. There have been changes in the state's approval process to emphasize stronger planning up front, and this proposal is consistent with those efforts.
And 2 thumbs up for that, I agree. Finance? Nothing. Any public comment on the MEDS modernization? Seeing none, thank you for the presentation. Let's move on to EWIC, Management Information System Project. We're on page 9 of the agenda for the public.
Good morning. Curtis Knapp, Office of Systems Integration. I'm the Deputy Director. That includes the current EBT system, and we'll talk about just for a couple of minutes and how that well aligns with our need today. Thank you, Madam Chair, for having us today, and members. To correct a record, if I could, last year I called you Senator Hawley, and I've been getting a lot of grief all year long for doing it.
You're kidding.
And you were very gracious.
And I don't even remember.
And you were very gracious. You smiled at me, and I appreciated that. And I took a lot of grief when I got back to the office.
Tell them to leave you alone.
It's taken a whole year for me to correct that action, so thank
All in fun. Just
It was all in fun.
Oh, good.
Absolutely.
Good.
So thank you, Senator Mitchell. So we're here today, we're asking for, OSI is asking for $4.1 million in support of a BCP. And the general overview is currently OSI has been managing for more than a dozen years the current EBT system that does transaction processing via benefits that are approved through the current consortiums in California. Those are under our arena as well. So under our current contract, EBT transacts with those eligibility systems and then produces benefits that currently go out on a card. That's been very successful. And we are currently in the third element of our contracts over this period of years and close to award of a contract the third time around. We've had a long relationship with public health over the last 5 years, and that they knew at some point in time they would need to automate their transaction processing. And although the currently EBT system is for cash and CalFresh benefits, and that the WIC benefits are a little bit different in that they're commodity-based or voucher-based, if you will. A partnership was developed about 3 years ago to do a joint RFP under a single contract with a single vendor to do that transaction processing, and that went very well. And that's in alignment with what, horizontal integration, interoperability, to leverage state departments where there's like opportunities so we don't have duplicity, and that's been very successful. So,
And we also don't have duplicity for the applicant in terms of having to provide the same information when all of us know and they know that they are entitled to all these multiple programs, and yet we ask them to access these services through multiple portals.
yeah, thank you. So giving you a little bit of background, so we have the current EBT project and the way we do transaction processing with the eligibility systems. This specific project is very specific in that California Department of Health has a legacy system that's been in operation for about 17 years, and that will be, we are going to be reprocuring a new system that will interact with the EBT service provider to be able to provide those benefits on cards. So we have a proven track record, a proven model in the way we've laid out the BCP that's been very, very successful. We have a federal mandate to complete that effort by 2020. And so the Department of Health is asked to partner with us for us to take over the procurement and the full implementation of those activities to meet that timeline. And we're very excited about that partnership.
Will there potentially in the future be a day where if I'm a beneficiary, I have one EBT card that I can access, say, my WIC benefits, my CalFresh benefits?
We talked a little bit about that last year. There are certainly opportunities. In the industry, they call that a multi-wallet solution. There's been several attempts to do that, and they have been unsuccessful to this point in time. Remember, we are riding on the national network for the transaction processing and so forth, and there's called if somebody wants to use their benefits at a point of sale device, what has to happen, really the major issue is where am I drawing this from? And it's called the drawdown process, if you will. So if you had Social Security on there, if you had your unemployment activities on there, if you had SNAP, cash, WIC benefits, that's been the stumbling block, but I think everybody in the vendor community knows that's something where we want to go, and they're pursuing that.
Okay, good, thank you. Senator Stone, anything? LAO, Finance, any public comment on EWIC Management Information System Project? Okay, we'll be holding this item open. Thank you.
Thank you.
We'll see you again. Moving on to item 4265, the Department of Public Health. Under Department of Public Health, we'll be hearing 19 issues, beginning with issue 1, the overview from the department.
Good morning.
Good morning.
Madam Chair, members. Brandon Nunes with the Department of Public Health. I'm the Chief Deputy Director for Operations there.
Good to see you.
Thank you for the opportunity to be able to provide an overview for our department. The agenda that you have in front of you does a really good job of laying out how our department's structured and kind of some of the programs that we have and our centers and structure, so to speak. So I figured I'd go.
Multi-layered.
Exactly.
Everything falls in the Department of Public Health kind of situation.
Exactly. So I thought what we do today, if this works for you, is I would give an overview of our department's budget, and then I turn things over to my colleague, Claudia Chris, to kind of talk about some of the policy priorities that we have in our department, if that works.
Works for us.
Okay, great. So I'll start very high level. Our department operates under a $3 billion budget. We have 3,500 staff located at around 60 locations throughout the state. And it's in those centers and offices that we administer over approximately 200 programs that are, the goal obviously is to optimize the health and well-being of the people of our state. So just speaking again, very high level, we have a relatively status quo budget this year, not a lot of major proposals in our budget, but just to focus on some of the numbers, of our $3 billion, we have approximately $130 million related to general fund. And this year, we have a slight request in general fund, and that's related to one proposal in particular in our infectious disease programs. We've identified some opportunities to be able to increase our lab capacity there so that we can, and it's for 14 positions and $1.6 million. And it's really a way to kind of fill those gaps that we've identified and be able to test additional foodborne specimens and identify outbreaks earlier. And so we have our leadership from the Infectious Disease Center who will be discussing that proposal a little bit later. And then our department's primarily funded with federal dollars. Approximately $1.7 billion comes from federal sources, and a large part of that is actually in our WIC program that we just discussed briefly. About $1.2 billion comes from that, and that's one of our major proposals this year is related to our eWIC system that you just heard from OSI discussing, and so we're very happy to have that partnership with them, the expertise that they bring to the table to be able to move this project forward, and so our funding that we have requested in this budget essentially supports that interagency agreement with them. And then finally, our department has about $1.2 billion that come from various special fund sources, over 40 different special funds that our department either administers or has appropriation authority from. And so to hit a couple of highlights that we have as far as BCPs in this area, we have a proposal for 7 permanent positions and $8.2 million from a childhood-led prevention fund that we have. And this will really allow us to expand case services to children who are exposed to lead. And so we have our leadership team again to discuss that proposal a little bit later, but just to hit that one. And in our Center for Healthcare Quality, we have a quality improvement fund that we're requesting $2 million out of to do some, it's been a progressive process with us to kind of identify some quality improvement projects, and we have this fund available to us to do some of those projects, and we're requesting $2 million from that fund. So with that, that's kind of the broad strokes for our department related to budget, and I'll turn things over to my colleague Claudia to talk about some of the
Before you do that,
or questions.
yeah, Senator Stone.
Thank you for your presentation. Could you just elaborate a little bit more on the lead exposure? Of course, we see all this terrible stuff going on on the East Coast with a water project there. But and I know that in I think it's pre-73 homes, you have to give a notice that there could be lead paint based in the construction year of the home. Are we still seeing lead exposure as a big problem in the state with our children?
Ollie, I would actually ask if we could defer to the experts when this proposal comes up, or
And that'll be issue number 12.
Okay.
and they'll be able to discuss a lot of the details
good.
surrounding that. I apologize, I don't have those.
I'd like to know where we are on that.
Yeah, but it will be one of the topics that we discuss.
But you're asking for some positions for that, correct?
Exactly,
Okay,
yes.
so I'd like to know more about that. Thank you.
Thank you, Madam Chair, members of the subcommittee. As you, I think, pointed out very well, there's a tremendous breadth that the department covers, Department of Public Health. A couple of items that we really wanted to highlight for you was our work on Zika virus right now. And you do have a proposal for labs, so we just wanted to provide you with an example. And Zika, I think, is top of mind of a lot of people in the public right now. The California Department of Public Health is coordinating closely with the Centers for Disease Control as well as our local health jurisdictions on the topic of Zika virus. As many people know, that this virus is transmitted by the Aedes aegypti mosquitoes as well as Aedes albopictus mosquitoes. These mosquitoes are not native to California. However, we do, as of now, have identified those mosquitoes in 12 counties in California. As of February 26th, this last week, California had 6 travel-associated cases of Zika virus for 2016 so far, one of which is a pregnant woman. And that gives us 14 cases in total so far since 2013. CDPH has requested that healthcare providers report suspected cases of Zika virus or associated conditions of microcephaly to local health departments. And the local health departments will then report the cases to CDPH, which then coordinates the referral of specimens to the CDC for testing. With the ongoing Zika outbreaks in the Americas, the department really accelerated the pace of diagnostic test development and validation of this disease. as well as other exotic mosquito-borne diseases such as dengue and chikungunya. So we're very happy to report that as of February 23rd, 2016, the CDPH Viral and Rickettsial Disease Laboratory began offering the polymerase chain reaction, or PCR test, that's recommended by the CDC for clinical diagnostic use. Additionally, effective March, coming very soon now, the lab will also conduct diagnostic serology testing for Zika using an immunofluorescent antibody assay, or IFA. This, the department's test capability for Zika in collaboration with the Centers for Disease Control will enable faster identification of Zika infection in California residents and strengthen the statewide preparedness and response to Zika and other mosquito-borne viruses. As my colleague Brennan pointed out, you'll hear a lot more detail on the medical marijuana legislation from our Assistant Deputy and Deputy from the Centers for Environmental Health. But of course, that is an area that we're very much focused on in the implementation and the work that's surrounding the implementation of the pieces that we're responsible for. Additionally, the Office of Health Equity project on reducing California disparities aims to reduce mental health disparities across 5 target populations. And as a reminder, that was funded by the Mental Health Services Act, Prop 63, that was passed in November of 2004. In total, CDPH will award $60 million to 41 contractors and grantees over 6 years to implement phase 2 of this project. And we're also happy to announce that the pilot projects will be announced very shortly. Ebola. The West Africa Ebola outbreak started in December 2013 and infected 28,640 people, of which over 11,000 died. It's been the largest Ebola outbreak in history. At this time, the travel and monitoring has been able to be concluded and has ended. However, the Department of Public Health continues to prioritize working with hospitals on infection control procedures for Ebola and other emerging infectious diseases. So that's another area of work that we're still focusing on. 2 more items. Centers for Healthcare Quality in the Department of Public Health is working diligently on completing the implementation of action items identified in the Hubbard report, and the most recent update on progress, which we publish on our website, was published on February 10th, 2016, and we're making good progress on those action items. Additionally, the center is actively engaged in the recruitment and training for the positions approved in the 2015 Budget Act, both the center as well as all district offices throughout California. And lastly, the center, with the help of teams representing various district offices, is engaged in quality improvement projects focusing on items such as complaint investigations and citations. The overarching focus for us is our ongoing improvement efforts around improving quality, reducing unnecessary variation, and improving standardization, as well as driving efficiency and customer service. And lastly, and our director would definitely want me to be sure to mention this, the area that we are focusing on, the California Department of Health, is really looking to the future of what public health needs to look like and of what the California Department of Public Health needs to look like. So we're looking to advance our work to make California the healthiest state in the nation in 10 years. To this end, we've recently embarked on a process within the department whereby we're aligning the department's efforts to one or more of the goals that have been adopted by the Governor's Let's Get Healthy California Task Force. Additionally, the effects of healthcare reform, the increasing recognition of the need to address the societal factors affecting health outcomes, as well as, I think was mentioned, the funding is not definite. There's a finite amount of funding, really has started to create a paradigm shift in the field of public health in general. There's no doubt that the public health department of the future is going to need to look very different than it does today. And the department leadership is actively engaged in the process to envision what the optimal public health department will look like in 20 years. The Let's Get Healthy California goal teams are helping to identify opportunities within the programs across the department where an explicit consideration of likely future of those programs will help inform strategies that will both help further work toward current objectives as well as position programs to better address future issues.
Thank you very much. And the director talked about that at Senate Rules hearing this past week, and so it was positive to hear that as busy as you are as a department, that there really is an eye on the future and an acknowledgement that public health is an emerging kind of field, and we need you to be to keep us healthy and safe. I think it probably makes sense to hold our questions for the specifics, because each of the issues she highlighted will address in these 12 issue areas. So fair enough? Does that work for you as well? Thank you very much for the overview. Appreciate it. We'll move now into the teeth of the matter. Issue 2, oral health. And I know you won't believe me, but I really wasn't looking at oral health when I said the teeth of the matter. I'm just that good, Senator Stone. I'm just that good. Issue 2, the oral health program. We're on page 12 of the agenda.
Thank you. Good morning.
Good morning.
Madam Chair, members, staff. Comedy always helps.
Yes, it does.
Very much.
We have fun in Sub-3.
Very disarming. Greg Oliva, Assistant Deputy Director, Center for Chronic Disease Prevention and Health Promotion. It's a pleasure to be here.
Thank you.
The years go fast, don't they?
They do.
It gives me great pleasure to introduce to you Dr. Jay Kumar.
Dr. Kumar, we have been waiting for you.
He's,
Took you a minute to get here, but we are glad.
I've grinded away all of that.
I'm sure you did. I'm sure you did.
But we believe he was worth the wait, given his extensive experience and career achievements in the state of New York. So we're delighted to have him here to serve as our state dental director. And I'm going to turn it over to Dr. Kumar to go over the excellent write-up and the questions for the committee.
So did I meet you in New York?
Yes, I think
We stole the dental director from New York. Go ahead, California. When you said that, I thought, I think I met you in New York. Well, welcome to California. That's wonderful.
Thank you.
I was on a trip with the dental school there talking about New York's amazing work they did in public dental health, and we stole Dr. Kumar.
Thanks.
It's a score for us. Good for
Thank you for that.
Yeah.
I'll go meet Miss Abbott and we'll split the champagne.
Right. Well, welcome.